What if the biggest threat to your health isn't cancer, an accident, or some disease you can't pronounce? What if it's your heart? Your heart disease remains the number one killer of men, and many of us don't even know we're at risk until it's too late. On this episode of If You Are My Brothers podcast, we're going to be talking about what every man needs to know about protecting his heart. Now, we're not talking about a relationship, can't help you here. When it comes to your health, we want you to stick around because this is going to be a very, very important conversation. Back in a moment. Welcome back and welcome everyone watching on YouTube. And of course, if you're listening on your favorite podcast platforms, we thank you for tuning in. Remember to like, share, subscribe. It affects the algorithm, but more importantly, it gets the word out to those men and men in your family or your loved ones that need to hear this message. So definitely do that for us. We really appreciate it. As you know, June is Men's Health Month, and we have been doing a 4-part Men's Health Month series. So we've been doing a show every week, and this is the third installment of the series. Today we're featuring a special guest and also my cardiologist, Dr. David Montgomery. Now, Dr. Montgomery is a board-certified cardiologist and the founder of PREventClinic here in Atlanta. Also known as Dr. Dave, I didn't know that. He is a sought-after TV personality and serves as a medical contributor for News Nation, which is America's source for fact-based, unbiased news. He's also made frequent appearances on CNN, HLN, and various national talk shows. And Dr. Montgomery hosts his own show, the Health Mystery Cafe, with Dr. Dave, and the web series The Good Doctor TV. Now, he's recognized for his expertise. He was voted one of Atlanta's magazine's top docs, and that vote is by his peers, by the way. And he believes that mass media and social media are crucial in enhancing public health globally. And I'm with you on that, Doc. Thank you so much for being a part of the If You Are My Brothers podcast. We appreciate you. I just want to say, for full transparency, you are my cardiologist, and you are on my health team. You keep me healthy, keep my heart going, working on me. And I just want to thank you for being here. Finally, we got you, right?
We finally did it, Hicks. Absolutely. It's a pleasure to be with you finally, man. I hope we can do some good here today.
Absolutely. And love your setup, by the way. And
Thank you.
We're going to definitely link and put in our show notes how to get to your podcast and all the things that you're doing. So I'm really excited about that. Yeah. Now, before we talk about heart disease and healthy heart and all of those things, I want to talk about what drives you. Now, I read somewhere that you were interested in medicine at the age of 9. Is that right?
Yeah, no, as crazy as it sounds, I was born on the south side of Chicago in a very middle class neighborhood. But yeah, it was around age 9 where out of nowhere, at least the story goes, out of nowhere, I started saying I wanted to be a doctor. And so, obviously when you go through all of the medical school and applications and you write this story down, I had thought for a very long time that I didn't really have a good story. And there were no doctors in my family that influenced me. My own pediatrician wasn't interested in me. I remember going to tell him when I really knew what I wanted to do. And he had absolutely no interest whatsoever. He was just going through the motions. Oh, cough, breathe, that kind of thing.
Right.
And so I don't know where it comes from. Except that it's providence, that it was placed in me. And, at around age 11, I started literally reading anatomy and physiology books, like real, college level books. And yeah, I always tell the story that I'm not really sure how much I understood at 11, but I certainly would spend a ton of time in this book and then I tried to teach it to my siblings and friends and stuff like that. Only a few of which would listen to me for any extended amount of time. But yeah, it started way back then.
And tell us about your motivation to becoming a cardiologist, because that's a specialty. You want to talk a little bit about kind of what made you decide to go into cardiology?
Yeah, again, it's this. It's when I look back on it, I'm like, what are you talking about? You don't have a story. I all the way through fellowship, I never wrote this story, but this is the origin story. When I was, sort of 11, I knew I wanted to be a pediatrician. Right, 11 years old. I loved kids, my baby cousins, and I just wanted to make sure everybody was healthy. So the doctor was there at around 9. Pediatrician was next. And then I got really fancy and I met a neonatologist. And, they take care of babies up through about eight weeks. And so I used to say neonatologist because I thought that was the coolest thing to say. But it still was a subspecialty of pediatrics.
Right.
And it wasn't until later that the heart stuff came through. Again, spending time in this book, I spent a lot of time in the heart section. I don't know why. I usually just say it was because of the reds and the blues that they use in the anatomy and physiology books for heart. But then my father died suddenly when I was age 13. So I was just about to, I just started high school, and he died suddenly, turns out, from heart disease. What had been billed at that time as a heart attack, I now know something different. But I never put that together. Like, it was, I just loved the blues and the reds. Then when I got to high school, I had one of my favorite teachers on the planet. Her name was Michael McCord. And Michael McCord had a very quirky way of teaching, but I loved it. Many students didn't, but I loved it. And she gave us an assignment to draw a heart freehand and bring it back, right? So don't copy, just draw it. Well, what she didn't know was that I was drawing freehand hearts from this John W. Hole published anatomy and physiology book since I was 11. So I had it down pat. And so I brought it, and it had shadows and valves, and all the chambers were right. I had labels, and she presented it to me when the parents would come up for grades. In Chicago, you have 4 marking periods. And on every other marking period, your parents come up and have a conversation. So parent conference. And she says, hey, David is a good student, but he cheated on this assignment. All I wanted him to do was just draw the heart. And I was like, you're sitting there with a teacher and your mother. Tell me what kind of agency you got with your teacher and your mother. I'm like, I drew that. I drew it. I drew it freehand. And she says, okay.
Draw it again.
Draw it again. I said, okay.
Not a problem.
And I did it, literally. She had to stop me. I'm drawing all the things. She was like, oh, my goodness. And she apologized profusely, like really was apologetic in front of my mom. That was a defining moment for me. I think that changed stuff. I'm like, heart. Heart is it. I scored. Although I liked the teacher, I still scored. And then there were some other things that occurred. I went on to study heart disease as a PhD before going to medical school. So it was pretty much locked in by Michael McCord, Miss McCord in high school.
Thank you, Miss McCord, because you wouldn't be my doctor if it wasn't for Miss McCord.
That's right. Yeah.
Oh, that's great. You're going to have to write the book, man. I mean, you've got the story. You're going to have to, take the time and go ahead and do it at some point.
Yeah. No, I will do that. I do have one in the works, but it's not about the origin story, but yes.
Okay, cool.
I'll come back on the show to talk about the book.
There we go. And I want to get an autographed copy too.
You got it. Too.
Okay.
Yeah.
So let's talk about heart disease. Let's talk about it being the leading cause of death for men. Many men worry about other things, cancer, accidents, and we are worried about a whole lot of other things than heart disease. So why do you think heart disease still, or does it get the attention it deserves?
No, I think it gets the attention it deserves in February, which is a shame. But probably the reason is because the people who sort of are the purveyors, us, cardiology community, we're really bad at marketing. So we have a marketing problem,
Mm.
right? And we know that because you take a condition like breast cancer, and Susan G. Komen shows you exactly how to
Yeah.
market. You want to know how to market? Somebody go sit with the people at Susan G. Komen and see how you get big, burly, 300-pound defensive linemen to wear all pink. And now you got somebody who's cornered the mind share of people to be able to do it. And when you market like that, you get a response. So the breast cancer deaths go down, right? Breast cancer screening goes up, right? All those things. Right. If you want to get a message out, whether it's about health or it's about, ashwagandha, you have to have the right kind of marketing. We just haven't put the power behind it in order to make that clear to not just everybody, society at large, but for primary care doctors who see the most people. If your primary care doctors aren't thinking, hey, heart disease, let me screen for heart disease, then you'll never go down the road to figure it out. Yeah, so that's where it is.
Do you think that men, when they do come to you, what do you think they're most afraid of when they're coming to see you? Or do you think they're even afraid at all because they don't really can't see it, can't feel it? You may be doing okay and until you're not, but do you think that there's any kind of fear or reluctance, particularly among men and Black men in particular, of coming to see you when it comes to the heart?
Yeah, I think there's a general reluctance for men in general, right? A reluctance to submit to an enterprise that, by definition, you hand over your agency. So the reason why I say it that way is because there's really only good that can come out of you going to see a doctor. Either you find out everything is fine and you come back the next year, or you find out everything's not fine and you work on whatever that thing is.
Right.
So there's no bad things. Some people are afraid of needles, but that's a small percentage of people. The agency piece does not get enough airtime. And so I'm glad we're talking about it.
Okay.
The last time many of the men who don't go to doctors went to a doctor, their mothers took them.
Wow.
And they were going probably for either a school or a sports physical.
Right.
Do you remember what happened to you at the sports physical? Let me tell you. Let me explain. Right? So they listen to your heart, they do all that stuff. And then there's the testicular exam. The reason why a pediatrician does a testicular exam is to make sure the male child does not have a hernia, where the intestines can gain access to the scrotum. And the way they do that is they go to the corner of each testis and make sure there's no opening. There's a little gap. That's touching your testicles, whether you liked it or not.
Right.
And depending on how old you were, your parent wasn't in there. It can get real deep. Okay.
Right.
Okay. Right. So when you're like 12 or 13 or even 11, maybe your parents like, oh yeah, I'm gonna let him go in there himself. You can't say I don't want to go. If I go, I don't want them to touch my penis or my testicles. I'm just getting just brass tacks.
Right.
You had no agency whatsoever, even for a man touching, if it was a male doctor, touching your testicles. How many guys are going to sign up for something like that? Really, honestly.
Yeah.
That you mean when I walk in the door, I've handed over my agency temporarily, and then I do whatever you say? Forget about the fact that for a really long time, there was this paternalistic sort of way of practicing medicine, where whatever I say is what goes. You do not question it. You do not tell me you're not going to do it. You don't stop a medicine. None of that.
Right.
And so very many of our guys remember medicine being practiced like that. Well, that's a percentage of people. So then there are some other percentage of people who have watched loved ones, maybe ones that are really, really close to them, go through something in the medical community or the medical landscape that was very unsavory. And if they're Black men, sometimes that's discriminatory, or at least perceived that way, or just not being treated well.
Mm-hmm.
Who's going to sign up to not be treated well? Who's going to
Right.
pay somebody? Because that's what happens. You
Yeah.
pay
You
me,
get a bill.
then I'm
Yeah.
going to not treat you well.
Right.
So it's more complicated than guys being macho and all this other stuff. It's got layers, and it's understandable when you break it down like that. So the way I practice, just to finish that piece, I work for you. That's the bottom line. When you
Right.
walk in the door, you hand over a credit card that says, here's my copay, here's my whatever. You just hired me.
Mm-hmm.
And we have to approach the relationship that way. Now, but what you hired me to do was to be a trusted advisor. You did not tell me to be like the language models and just make you feel amazing. Right? Say, oh, yeah, that's a great idea, when it's really not a great idea.
Right.
You're the president. I'm the advisor. The advisor has agency, but the president makes the final decision.
Right.
That's the relationship.
Oh, very interesting. I never thought of, and as you talked about that, and we've had this discussion before about the DRE when it comes to the prostate exam, and how, that's even more invasive as we get older, and that has a whole lot of other things around it. But the whole thing about the agency part, I've never, kind of put that together. So that's very interesting. So, men listening right now, they feel fine. They always say, I feel great. What happens when you got a patient, they're feeling great right up till they have a heart attack or a stroke? How is it, you've said that it's a silent kind of killer. It kind of creeps up on you. What's going on for us to get to that point?
Yeah, I disagree with a lot of the things. So I'm sort of a contrarian. I don't know that it's true that we can say that a man, or anybody for that matter, goes all the way up until the heart event happens with no symptoms whatsoever and then dies, especially of a heart attack. What I more believe is that he has either ignored what he feels or has miscategorized what he feels, understandably. So heart disease, let's just talk heart attacks, because there's many different forms of heart disease.
Right.
But the kinds that'll take you out instantly, right? So heart attack is one of them. That's when a vessel blocks in your artery, the heart doesn't get any oxygen, and it dies. The heart tissue dies, and then you have a major trouble. Before that occurs, it is likely in many of the men that they felt some kind of change in capacity, energy level, sleep, fatigue, chest discomfort, still number one, shortness of breath, something. But often, especially as we age, we start assigning it to the fact that I'm,
getting
maybe
older.
I'm 52. No, 52 is young. What are you talking about?
Right.
This is not 1838, right? I was, what was I reading? Right. Beethoven, this genius, was dead at 44. Henry David Thoreau was dead at 56. I mean, like back then,
back in the day, right?
Yeah,
right.
I mean, 56, man. You didn't get a chance to get a bunch of gray hair, man. You were out of here, okay?
Right.
But that's not a little historical fact. But so we miscategorize some of these things. We say, oh, I just been feeling tired and I'm stressed. I don't sleep that well, and those things can be true. And what happens is you file it in a different category. It's like, oh yeah, I'm really tired now. Oh man, right? And you just keep categorizing it. That's very common. I don't know what the percentage is, but that's probably more common. Or a guy's feeling something and never talks to anybody about it.
Right.
I don't want to worry my wife or my kids or my mother, right? These are, it's not all kind of like some shady, sinister reasons why you don't talk about it. It could just very well be that that you don't want to burden somebody. All of those things are wrong given the enemy. The enemy is heart disease. It's wrong to categorize something on your own. It's wrong to not tell somebody because you don't want to bother them. Because if you go, you will bother them for a really long time.
For a long time, right.
You don't want to do.
Right.
So that's the message. So what I tell my guys is, especially if they're coming to see me, is be afraid and do it anyway. Be angry at what happened to your mother and go get checked anyway. Be embarrassed, be guilty, be ashamed of what happened to you as a child, because we didn't get into how, dirty it could have gotten.
Yeah.
And go get checked as an adult anyway, because the stakes are too high. There's somebody that is counting on you to be as healthy as you can be, and you can't be that if you ignore a symptom. Some guy's sitting with a mass. They know it's wrong, but they want to ignore it. Don't do it. Listen to me right now. If you were waiting for a sign, my friend, this is that sign. Go talk to somebody about it. Do it anyway.
Yeah. And the other part of that too is I would imagine, kind of know where you are, right? I mean, from blood work, your high blood pressure, family, and how much does family play in all of this as well? Because a lot of times with men, we know some of these things. We know we're at risk and ignore symptoms anyway. But then there's some that really don't even have a clue as to what the family history is, or, kind of, they know they got high blood pressure. They may be taking high blood pressure medication, cholesterol, but, it's like, oh, I take the medication, I'm okay. But knowing that you're at risk, I would imagine too, is kind of that first thing of, hey, you're at risk. So this is something that could turn out to be something a lot worse.
Yeah. No, I think, the calculus that you just went through in your mind is not the calculus of the guys who don't go. And you're right. Let me just hit those points because they're really important ones. Knowing your numbers can only happen if you go get the numbers. You can only get the numbers from a physician. Currently, you have to go to some kind of medical establishment to get the numbers. So whether you go to a lab and you just get the lab reports, that's a health establishment, a healthcare establishment, if it's a third-party lab or not. To really understand everything, you really have to currently, in 2026, go to a human being that will help you put it all together. Your family history is a part of putting that all together. So you're absolutely right. If you don't test, you don't know. That's principle number 3. So if you don't test your heart, your colon, your prostate, you don't know, because much of disease starts at a time where there really truly is no symptom. So the plaque starts at a time where there just can't be any symptoms. It's a little baby thing that if I'm not looking at it on a granular level, I wouldn't be able to see it anyway. You want to catch it as early as possible. And the only way to do that is to test. If you don't test, men, you don't know, period. So you think you feel amazing, just like the marathoner this summer will run his 16th marathon and never run again, because you think, because I'm healthy, I don't have to do it. Listen, marathoners are some of the healthiest people. Let's face it. But they also have genes, to your point. We've all heard the story.
Yeah. How important is that, to know that family history, and how much of it plays into what happens to you? Is it, if your mom or your grandma and everybody had heart disease, are you 80% or 50%, or is it, or is it even inevitable that you're going to have some issues based on your
let
history?
me circle back to the inevitability. I'm gonna write this down so I make sure we get to inevitability. That's a different thing, but it's hard to be able to put a number on it. And I'll talk about what I think about numbers in medicine anyway, but statistics don't really do what we think they do for people. Kind of do one of these. You can't know what percentage a genetic abnormality will play in your outcomes, but you should understand your family history. Let's distill it down to that. You want to know your family history, and you want to act as if you could have whatever the person had. By that, I mean, it is not guaranteed that because your father died of heart disease that you have to die of heart disease. But in order to know the road to travel, you have to have the roadmap. The family history is a part of the roadmap. If you do this, there is a pitfall right there. And if you go down that same road, you may have the same problem. But the roadmap says, but there is a way around it. If you go this way, you'll still make it to the destination of a long, healthy, fruitful life, but you won't have to have the plight of your father, your mother, your cousin, your whatever, your grandmother. The roadmap is your guarantee of travel. Like this is how you travel the road. I know where I'm going by the roadmap. The roadmap includes my family history. Here's the thing that men often do. We will qualify the family history. Let me explain. Oh yeah, my dad, he had heart failure and just really didn't take care of himself. He drank, he smoked, and yeah, he wasn't good. What they're doing is saying, yes, I have this person in my family who is my blood relative, first degree. But because the reason why he died was not the gene, but because he did all those things. Now, that may be true. But sometimes there's a background of genetics. So that's why I said a second ago, act as if you could have the same thing. Now, you don't smoke or drink or do the things and have the life that he had or she had.
Right.
But you're still their offspring. You're still in that lineage, and you still may have the gene. So you're going to get that roadmap out and say, yeah, I'm not doing that. I'm going to go get checked.
Right.
I'm going to go let somebody check me so to make sure. And that's when you start filling in the, oh, yeah, I don't have that. That must have been dad smoking. Oh, yeah, I don't have that. That must have been mom letting her blood pressure stay high for a long time, and that's why she died at 60. So you get what I'm saying? But But remember, the principle 3 was, if you don't test, you don't know. So you have to go and test, plus know the family history. Now we're building a real strategy, a real toolkit for men of any race to take and say, because I got life to live that I want to live, I got stuff I want to do, I want to benefit from the fruits of my labor, let me make sure my health strategy is as solid and strong as my business strategy, as my financial strategy. You see what I mean? Yeah.
Yeah. Do you think that we're turning a corner on that? The men that you well, I know you at PREventClinic. I mean, that's something that is sort of your mantra is knowing all of those things. In general, though, do you think we're kind of turning the corner? Have we made progress getting back to the marketing part and the people and men understanding? And I'm talking about men now because, we can be knuckleheads sometimes.
Yeah.
Most of the time. But are we moving in the right direction? Are you seeing really change, just, not statistically, just kind of what you're seeing out there?
Yeah, I mean, and so in my micro world of the whole human population, billions of people, we only see a few thousand a year. But yeah, I do. I see men who often are, not all the time, but often are brought in by, spouses. And so sometimes I say wives save lives. I got to get more universal. I do understand with that phrase, but they are there. And once you make the connection, see, that's my job. See, we can't blame it all on guys. Remember, I just said that the reason why heart disease still enjoys this terrible fame, which is the number one killer of all people, more than all the cancers combined, is because of a marketing problem. We haven't marketed enough to people to say, go get your heart checked along with your prostate, your colon, your breast. But it's also the doctor's fault that when you come in, when I finally get you there, that I don't do what I'm supposed to do. So the phrase, I meet them where they are, is not a denigration. We're not down grading something because people can be in different places. People can be depressed and they can be super happy. They can be overly optimistic about their health. Meet them where they are means that you have to figure out who you have to be for that person at that time to help them extract as much as they can from their health data and to want to do it. I'm a coach in that. I got a bunch of metaphors, but I become a coach in a certain part of it, right? So if I come in and my player, who's a star player, doesn't win the game, that's not all the player. Sometimes the play you drew up was terrible.
Right. Yeah. It's a coach. Yeah. Right.
I mean, we've seen it in professional sports. You
Yeah.
get a dynamite player and you put him
Mm-hmm.
with the wrong coach. You're like, man, get me out of here, man. I can't.
Yeah.
Right.
Yeah. Falcons. No, I'm just
Right. Well, I mean, let's go down the list. I
Yeah.
mean, until you find your Belichick Brady, until you find that kind of that link,
Connection. Yeah.
and that's what you should be looking for. So I always say this phrase too: go find a doctor that you trust. But really, what I'm saying under there is, go find a doctor who's on your wavelength, your wavelength.
Mm-hmm.
Go find a doctor that you click with,
Mm-hmm.
that can click with you, because then
Right.
the trust goes away. I don't distrust you. Now we can get down to some real serious stuff, because the shrouds go away. I take off my shield, I take off my armor, I drop it on it, and then we can have a real conversation. Because when a man comes into my office, he's like, "What are you going to tell me?"
Right. Right.
So yeah.
So, looking at how healthcare is today, often patients have to be referred to you, right? I mean, so what if can you just go and say, hey, I want to have a healthy heart, and I'm going to put my team together, and I'm going to see Dr. Montgomery, even though I may not, I don't know. Sometimes you have to have a referral to get to you.
Yeah.
Are you seeing that people are like, part of my healthcare team is going to be a cardiologist that I see on a regular basis?
Yeah, well, I'm seeing that a whole lot more now, especially because the insurers, the big, insurers, commercial insurers, are making it so hard for people to make sense of the calculus of paying what they pay,
Right.
but not getting.
Yeah.
So many people are just coming in and saying, "Hey, I want my heart screen." We're certainly seeing that for husbands or sig others of women who have been to the clinic, because our clinic is probably 60-40. Women, more women than men, which is really good at cardiology. That's really good. Okay. So with that being said, you don't need that for our office. You can walk in with cash and get yourself evaluated.
Right.
And the amount of cash that it takes you to get a heart evaluation, it'll blow people's minds how affordable it is.
Okay.
Right? You can get a full cardiac everything, all the things that I do for an initial evaluation for almost half of what it costs you to get a pre-nuvo cancer screen. I do want to say something. What I don't like when we are doing the compare and contrast between different conditions is putting a value on one over the other. And that's not what we're doing. And I want to be clear to men, because their sensibilities might be toward a certain condition because it's in their family. They might have lost somebody. Just because, here's the analogy. Here I go with another.
Okay. All right.
Just because
I'm used to them, because you do that.
You get it all the time. You're like, here it is. Just because right now we're saying, let's save the sea lions. Let's say there's an endangered species. Doesn't mean we don't want to save the dolphins.
Right.
Do you get what I'm saying?
Right.
Just because we're saying it's really important for you to get your heart screened does not mean it's not important for you to get your colon screened. It does not mean that you should get your prostate screened. All the animals are really great and important, and they have a role in our ecosystem. And all of the parts of your physiology are important and great and have a role in your internal ecosystem. Go get yourself checked. If you don't check, you don't know.
Well, that kind of segues into my next question, which is the connection between, because this is a show our podcast, we deal with prostate cancer. And what do men know about the relationship between cardiovascular health and prostate cancer, prostate health, recovery after prostate treatment? What's that connection?
I think to distill it down so that there's something that the viewers and listeners can kind of take home is some of the same risk factors for heart disease are risk factors for prostate cancer. Namely, a high-fat diet. Now, we don't really understand all of the reasons why men of African descent, and I should be really specific about this, African American men have such a high propensity for advanced prostate cancer. We don't understand all of why.
Mm-hmm.
And there is no part on the black gene, the gene that makes my skin color and my hair color what it is,
That's
is linked
connected,
to prostate cancer.
Right.
There's something else. So, for example, in breast cancer, commercial break, in breast cancer, they found that there are actually genes that were important for survival on the African continent that now aren't that helpful and may predispose to advanced breast cancer. That's not because the women are black skin color, hair color. It's because of a gene that they evolved living on the continent. Okay. So there's probably something like that. We just don't know what it is yet. With that being said, we do know what a few other things are.
Okay.
Number 1, alcohol. Number 2, smoking of anything. Number 3, high-fat diet. So I started with the high-fat diet because everybody listening can think of, because not everybody that's listening is a smoker.
Right.
Not everybody listening is a drinker, which drinking sometimes goes under the radar, but it's a major cancer problem, risk factor. But it's the high fat diet. You got a lot of fat, and you get a lot of prostate cancer in men who eat high fat diets. That comes in our fried foods, that comes in our processed foods, that comes in our fast foods. So that's it.
Yeah. As we kind of move along, I do want to, I've asked all of my guests during this particular series about, as we talk about high fat intake and diet and exercise. Yeah. What is your take on the GLP-1 craze? What are your thoughts about that?
Yeah, it's a breakthrough. It is a current era breakthrough. And I believe in most therapies at the right time for the right person, the right duration, the right reason, with the right goals and timeline. You see how we flesh that out?
So, right.
So same thing with the GLPs as it is with everything else. There's a myth in American healthcare. Oh, if I go on something, I'm on it for
ever.
No, that's a myth.
Yes.
Oh, if I start this thing, I got to take it forever. Where do we?
Yeah.
Wait a minute. Where do we? Yeah. So there's a lot of those. Maybe we'll come back next time and do the myths of healthcare. That's one of them.
I like that. Let me write that one down. Right.
That's not a thing. I'm sorry. That's just not a thing. There's no medicine right now where if you start it, you can't ever stop it. Now, what the commercials will say is, for certain things like a blood thinner, don't stop without talking to your doctor, as there could be risk. Okay, guess who that is saying that? Guess what group of professionals that is?
Is that the pharmaceutical folks?
That's the attorneys.
Oh, the attorneys for the pharmaceutical folks.
Yeah, no, the attorneys say you've got to tell them don't stop it. Well, and what we know is that sometimes if you stop it, you can predispose yourself to the thing that we're treating you with.
Right.
So for atrial fibrillation, you could actually have a stroke if you stop your medicine without talking to a doctor. But it doesn't mean you never are able to talk. You're not able to ever stop it. And they don't say that on any commercial. Go to YouTube. There's none of that on there.
Right.
So, but the GLPs, just to really drill down, is a really important breakthrough because of the world of obesity and the outcroppings of the manifestations of obesity, including type 2 diabetes, which the medicine class was initially designed for. And then, the scientists have been seeing this for a really long time before you got the first GLPs, which is like Saxenda and Victoza and some of these ones nobody's ever heard of before.
Right.
On them. And then all of that information that we're starting to see where these medicines started, getting people to lose weight. When Ozempic was being developed, it was an iteration on the earlier GLP-1. Ozempic just blew it all out of the water. So what scientists have been seeing at the research bench in animals, they saw really good in the phase 1 and phase 2 trials. And they were like, oh my goodness, you're losing weight too. But they couldn't talk about it yet. What they did see was the heart protection. So that's why I love them. So the GLPs,
Right.
when Ozempic first got approved, I don't know, 2017 or something like that, the commercial was not about diabetes. The guy was walking around, man on the street video, a commercial. He says, "Hey, how's your heart?" Do you remember that commercial? You might.
Yeah, I remember that. Yeah.
It was not about diabetes because the indication was really clear that this was going to be heart protective. That was Ozempic in 2017. We didn't get to this whole weight loss thing until its partner, Wegovy, was approved for weight loss in 2021. And then, boom, inflection point. It got very, very popular. The bottom line is, in people who can tolerate it, not everybody can, it is a really great medicine. And talk to your doctor about all of the ins and outs. I sound like the attorneys now.
Yeah, but I think what you're saying too is, don't just go get a shot and get started, and you really need to have a plan. You really need to know, talking to you or another health professional, what that plan looks like. What are your goals? How do you get there? Because I remember, I guess the actor that was on Abishoba Loves, well, I forget, he was a big guy, and he was the spokesperson for one of those. It was about diabetes. And then like a year later, he was, had lost like 70 pounds. And people were like, "Oh my goodness."
How did that happen?
How did that happen? And then I kind of saw this shift to, talking about weight loss. And you said something, and I just wanted to just ask about this, that you don't have to be on it forever, right? I mean, should you go into it saying, my goal is not to be on this thing for, because I've heard that if you get off, you start gaining weight again, or how do we kind of negotiate that, or do we?
Yeah. What we're learning on the ground is, if you start and stop quickly, you'll be in for a rude awakening. So you have to have a plan. That's what I'm talking about, a strategy. How long? What's that duration? Right. What we're finding is, if you're going to be on it, what we're doing in my clinic, quite frankly, is just mirroring the clinical trial. The trial ramped people up every month. It went up on the dose, got to the peak dose that they could tolerate. Most of the time, it's the full dose. And they stayed on it for 12 months. What we're doing now, and what we've learned through the last 5 years, is that you can't just pull the rug from underneath them. Excuse me. You've got to have. It's almost got to look like a trapezoid. It's got to have slow ramp up, and the ramp down is even slower in my mind. Because what you're doing is, we have GLP. We have an endogenous GLP. The endogenous GLP gets broken down really fast. It doesn't work as good as the one that they give you in the shot.
In shot, right.
So that one, it works longer. You
Mm-hmm.
all of the same effects, but it's stronger, more intense, more potent, and it lasts longer in your body. When you take a hormone like that, the hormone system in our body has something called feedback. If there's too much, I stop making it. If there's not enough, I make more. So here I go.
Okay.
I'm going to take my, right?
Mm-hmm.
If I'm giving myself really high doses of long-lasting GLP is going to bind onto its receptors. The body's going to say, we got to
I don't need to do
this stuff.
Right,
So what am I going to do with my own? I'm not going to make it. Now you do that for a year. Your body doesn't make any GLP. Part of what GLP does is exactly what we're learning it does now. Helps you regulate the insulin release, and therefore glucose control. Your stomach, and the way your stomach empties, how full you feel. And then all of the brain stuff gets into the blood-brain barrier and has all these other effects. And that, we're still trying to figure out all the stuff that happens.
Right.
That is probably the most fascinating part, and why I think the medicine works so well. Then you pull it away. Listen, these guys are gone. Your own personal GLP, the endogenous is the word we use.
They're on vacation, right?
They're on a European vacation. They're on 6 weeks, man. Okay? And you're so now you have no GLP. Your appetite center's not turned off. Your insulin's not working right. What's going to happen to your weight?
You're going to gain it. Yeah.
Like really fast. Now, some people, we learned the hard way, gained it and gained more than they had before. So one of the other unfortunate things is that people develop real mental health disorders. Now,
Right.
that may be a separate mental health effect of the GLP. They're still sorting that out. But some of that is because they were feeling so amazing. Their identity was slowly evolving into this person who was no longer obese. And then bang, it all came back.
It came back.
So depression, anxiety, body dysmorphia, all of these things. Okay. So we're going to have that happen to too many people for me to know that we should slow it down.
Right. That
And
it's
so
got to be a off ramp, a long off ramp, a long runway to get you.
That's right.
To get you where you need to be. So when you stop, you're not, you can get back to maybe exercise and doing some things to kind of keep the weight off. Yeah.
That's right.
Yeah. So we're going to wrap up here in a minute. I know we got a ton of questions, and I knew this was going to happen. I was like, you know what? I'm going to have to do a part 2 with Dr. Montgomery, because when we're when you're in the exam room, we have these conversations, and man, you're just breaking it down. And, I do appreciate the fact that you take time to work with me, and because I need all the work I can get. But let me just say this, that I do think about you when I have an appointment like 6 months out. As I get closer, I say, oh, what have I done? have I been sticking to what we talked about? I got to go in to see doc, and it's like my weight. And so anyway, I just want you to know you have that effect. So I do try. I am trying. Yeah. But what's some of the, just some questions that a man or anybody really should ask their cardiologist, kind of a checklist, if you will. And what are some of the tests that you should look to get on an annual basis?
Yeah, I think you hit it right on the head. What is my risk of having a cardiovascular event in 10 years, in my lifetime? That's going to be full of all kinds of data and information. The tests that every man should have are 3 things and a blood test. Stress test. Echocardiogram. Coronary calcium CT, or a plaque score. You want a plaque score. Every man over 40, no matter what the risks are in the family or what your individual risk is, every man over 40 should have that done. Just like every man over 45 should have his first colonoscopy if he has average risk. Every man around 40, if he has average risk, should start really testing his PSA. And just a commercial break again, we don't do the DRE, digital rectal exam, anymore for screening for prostate disease. So men can just put that away. Like nobody should be doing that first. It's a blood test. Anybody going for that first is either got some problems or is not up on the guidelines. Okay.
Right.
So so we said stress test, echo. Echo is a heart ultrasound. Echocardiogram, not electrocardiogram. That's the EKG. Echocardiogram is an ultrasound. I see size of the heart, chambers, valves. If Damar Hamlin had an echocardiogram when he passed out on the field, they wouldn't have been asking, did he have underlying heart disease? It turns out he didn't. Every man should have a stress test, echocardiogram, and the plaque score CT. It's just a non-contrast CAT scan. Nobody injects you with anything. There's no IV. You slide in, you hold your breath 2 or 3 times, and you go home. The CT scan with the plaque score, which is a CT scan, is the easiest of all of them because it only takes less than 10 minutes. The blood test every man should have, apart from your general blood work. Remember, if you don't test, you don't know. So you're definitely going to go ask your doctor what your risk is for having a cardiovascular problem in 10 years. So he's going to get some basic labs. But a lab that's not so basic is called LPA. Lipoprotein A is a genetic marker that you get. You make it as a child. You get a copy from mom and dad, and you make it. You can eat cardboard. It doesn't go down. You can take medicine. It doesn't go down, at least so far. We're coming up with one soon. And you want to know what it is, because if it's high, it imparts or confers risk. You want to know what that is. All my patients have it. If we don't talk about it, that means it's normal.
So
Okay.
it's okay, right?
But those
That's
are
well, that's one I don't have to worry about. Got to worry about everything else, but interesting.
At least you know what you have to worry about. It's the guy who thinks he doesn't have anything to worry about that I worry about. It's the guy who has health arrogance who I worry about. Because a guy who harbors an arrogant stance about his health, like, you know, I mean, I got guys 70 years old talking about, listen, I'm an athlete. I'm like, oh, really? Tell me more about that. They're talking about when they're 16 years old.
Right. Let me see how long you last on that stress test. Because I'm gonna tell you, you start feeling, you kind of know where you are. It's like,
that's
okay,
a male
I'm done.
thing. Yeah, the males do that. Yeah. Women don't come and say, oh, I played volleyball. No.
Right.
They know that things change. Guys, we're still locked into adolescence, like.
Right. So with that being said, before we close, let's do a little scenario here. So if you had 60 seconds on every radio station in America right now, and every man was listening, what would you tell them about protecting their heart?
Yeah, there's nothing more important than your health. And a part of your health is one of the most important systems in the body, and that's your cardiovascular system, where your heart is the center. Because it's so important and so far-reaching, it touches a whole bunch of parts of your body. You got to know that it is pumping and working well, and that you're not at risk for something. Here's my simple message. If you don't test your heart, you don't know if something's wrong, because not all the time will you feel something. Go get your heart tested. That's the bottom line.
Okay. I have to ask you this before we go. And, I have two more questions, but, something that always kind of bothers me is, not bothers me, but, like you can test your heart. I know we do the for stroke. What are some of the things? Because I'm always afraid that, because I hear of people who, heart was okay, and then they just have a stroke. And I know that my grandmother died from a massive stroke. And it just seems to me like I'm never quite sure, am I okay when it comes to, I know blood pressure plays a part of that, but what else? And I know you do some tests on me, but are there things that we can do? We didn't talk about stroke much, but just as we close out.
Yeah, but a part of a cardiovascular screen includes stroke risk assessment in the appropriate age. Blood pressure is the reason why most Black people have strokes. Out of control diabetes is the other reason that most Black people have strokes. High cholesterol is the third reason why most Black people have strokes.
Right.
So when you want to know, what do I do to try to mitigate that, it's first, let me go see what my blood pressure is. Let me see what my cholesterol and my blood sugar is, and then work extremely hard to normalize them if they're not. To put away the ego if the doctor says, I think we're at a place where you should take medicine. Because the stakes are too high. Let me just tell you something. I've got all kinds of really high functioning, high value captains of industry, celebrities, big time celebrities that come to our office. And here's what's true about all of those up there. They do not play games with this little simple medicine stuff. I do not have like top guys coming in talking about, nah, man, I ain't taking that. I can't, I ain't taking no medicine.
Right.
I don't see it. You know why? Now, they're looking for alternatives. Don't get me wrong. You don't just come and just lay them out.
Right,
a whole tray of medicines.
That's right.
But what they say is, if you really think I should take that, I'm taking it. And you know why they want to do that? Because they want to live as long as they can. They're like, hey, this life right here, baby, this life is great. I am not going anywhere. So what do I have to do? You want me to take this pill? I don't want to. Are you sure this is what I have to do?
Right.
Okay. You want to and guess what they do? They take it, and you won't even know. You don't know. You can't look at these guys. I'm telling you.
No.
The guys we look up to, they're taking something.
Yeah.
Stop playing around with this stuff. Take them. I had one of my friends, man, grew up with him, went to high school and elementary school. Says, oh, Dave, the doctor wants me to take the medicine, and he sent me his blood pressure. I had 3 words: take the
Take the
medicine.
medicine, right?
And
Yeah.
then boom, and I turned the phone off. No, man,
Yeah.
listen, forget about it. We got to get past all of the stuff that we're like some perfect Adonis. Listen, nobody has a perfect physiology. There is nobody alive whose physiology is perfect. They have something.
Right.
Some people have more than one something.
Mhm.
Here's your job. Let me figure out, if I'm talking about myself, let me figure out what's not perfect about me. Let me find out the imperfect things about me, and let me work really hard on that. I may not have to work on this one. Thank God. Okay. But I got to work on this one.
On that.
And
Yeah.
everybody watching has something. Go find it. Go work on it really hard and live a fruitful life. That's what all of the top folks are doing. Go do it.
Yeah. Yeah. And I will tell you too, that to have somebody like yourself who I trust and I know it's going to, lead me right. That's a big part of it too. And I do appreciate all that you do and how you go about medicine and really working with me. Because I want to be in your office. I read somewhere I want to be a proud. Don't y'all have this thing called
the
proud?
prouds. We do the prouds.
When you get off of your medication, and that's what I'm shooting for. I didn't even know that. I said, what? I need to give me a T-shirt so I can be motivated.
Yeah.
to be a
That's
proud.
A good idea, actually.
Yeah.
Write that down. Okay.
Yeah. There you go. Yeah, man. Get a coffee mug or something.
Here.
I mean, something that can inspire me. But but beside that, I just want to let you know that you are an inspiration. You have really worked me through a lot of my issues. And I'm just blessed to have you on my medical team. And thank you so much for taking the time. I'm gonna get you back now.
Yeah,
so
we're gonna do it. We're gonna do the myths.
Just put me on the list.
Yeah,
that I'll be calling to get you back. And thank you so much,
it was a pleasure,
Doc,
man. Real fun
for joining us.
Absolutely.
All right, we'll be in touch. All right, thank you, Dr. Montgomery, for everything you do. Your heart works for you every second of every day. And the question is, what are you doing to take care of it? So don't let today's conversation end here. Schedule that appointment, learn your numbers, take that walk and make the change. Take the walk to the doc and make the change, because the best time to protect your heart is before it gives you a reason to. So take that with you. Now, this conversation, if it's helped you, we ask you again to please share and like, subscribe. Affects the algorithm, but more importantly, it alerts you to future episodes, and also you can pass along the information to other people in your family and friends and colleagues. Now, if you want to learn more about what we're doing with If You Are My Brothers, we have a website, IfYouAreMyBrothers.org, and there you can learn more about our documentary that we are reworking for our community efforts. We've got a podcast series, of course, that you're watching or listening to right now, and also our community engagement work, which is so important, going out in the community and spreading the word to get men to take notice and turn health awareness into health action. That's what we're about. Now, If You Are My Brothers is a part of Straight Street Media, which is a 501c3 organization, which means that you can support us, and it's tax deductible. And so we want to encourage you, as Danny puts up our slide every week that we do this, we ask you to scan the QR code there. It'll take you to our website, our donate page. You can use that. You can visit our website, ifyouaremybrothers.org. You can also mail us a check. So, I mean, believe it or not, there are people that still have checks. I tell my millennial son all the time that there is such a thing. But you can help us do what we're doing with our podcast, with the documentary series that we're putting together, and also with our community outreach. Now, we want to remind you that when you do make your contribution, we have the If You Are My Brothers mug, and there it is. Is it backwards? I don't know. But anyway, this is our new and improved mug, and we want to thank the folks at Atlanta Brand Central for donating the mugs. As my dog says in the background, Eddie, it is time, Dad, to wrap this thing up because I got to go out. So we're going to do that very quickly. We also want to thank Danny Garcia Pozo. Sorry about that, Danny. You can edit that out, right? He is our producer. He's great. And thank you, Danny, for all that you do. Zach Reynolds at Borkhouse Productions for doing our opening as well. Check Zach out. He does some great work, and we'll have a link to his company in our show notes. Now, remember, this podcast is not a substitute for medical advice. Always talk to your healthcare provider. And we want to thank you for being a part of our third installment of our Men's Health Month special series. And you can look for our fourth installment coming up in about a week. So stay tuned for that. Everything drops every Wednesday. So if you're subscribing, you will get a notification, whether it's YouTube or on your favorite podcast platforms. So until then, remember, if you are my brothers, you'll share this message. And as always, we are in this fight together. So we ask you to take care, stay healthy, and keep the faith. Peace.